Welcome to our program on frequently asked questions about food safety and the coronavirus. Joining us today is Dr. Ben Chapman, a professor and food safety extension specialist at North Carolina State University. Thanks for being with us today, Ben.
Thanks, Margie.
So I need to do some grocery shopping. It's been a week now, and when I went last time, I shopped in the morning right after they opened. I put on disposable gloves, and after I took my cart back at the end, I just tossed them in the trash can right outside the door there. Do you think that disposable gloves are a good idea? And is there anything else that I could do to minimize my risk while grocery shopping?
Well, let me take you through how I'm approaching grocery shopping, and it's similar to what you just mentioned. But the first thing I'm actually doing is thinking about the cart or the basket that I'm using as I'm picking up my groceries. So for me, I'm looking for whether there's a cart wipe there. And in some grocery stores I've been to over the last couple of weeks, there are. And if not, that's actually one of the times that I'm using wipes that I'm bringing with me to just clean off, sanitize, disinfect whatever might be on that cart handle. So I'm controlling whatever might have happened from someone else getting there. The second thing I'm doing, and you mentioned disposable gloves, it's not actually, I think we need to be careful in this one a little bit. I don't want to put a message out there that you have to use disposable gloves or washing our hands or using hand sanitizer or a combination of all three of those things really are a good practice. And the reason I say that is disposable gloves right now, with where we are with our healthcare system, I really don't want to divert disposable gloves away from medical professionals. I don't think it's necessary that I'm using those in a grocery store when I can manage my risk with hand washing and sanitizer. But similar to what you're saying, when I go in there, I'm being really careful to make sure what I'm touching and what I'm not placing any risk for virus that I might have on things, and then really cleaning and sanitizing my hands. One thing that we didn't mention right at the top that I really think is important in anything that we're doing when it comes to food is sort of remembering this. The biggest risk around COVID-19 or the transferring the virus is actually called SARS-CoV-2. The biggest risk is actually being around someone who's sick, being around someone who's symptomatic. And so right at the start, if I'm ill, I'm not going to the grocery store. That's like number one thing at the top of my list with a bullet. There's nothing else that I think is more important. It's really restricting my exposure if I am sick, exposing that to someone else. And then the number two thing that I think is really important is right now we're talking about a very theoretical situation on food and food packaging. I'm sure we'll talk a little bit more about that. But food and food packaging, we don't have any evidence right now that they are transmission routes for this virus. So everything that we're talking about as we talk about shopping is really about being very precautionary, extra risk reduction, but we don't have any evidence right now that that food or packaging or carts are really an area of transmission. It's really number one is being around someone who might be coughing, might be sneezing, who might inadvertently spit a little bit as they're talking with that mucus coming from their mouth getting right on me.
Well, that's sort of a relief. Actually, I mean, to me, that's good news to hear that. But I have read that viruses can live on plastic for maybe 5 days and paper or cardboard for even longer. So whenever I come home with my groceries, I've been putting them away, and then I sanitize my counter that they were on. Do you think that it might be prudent to sanitize the groceries somehow?
I would say emphatically no, and here's why. The biggest thing for me right now is really conserving the products that we have for sanitizing and disinfection. I want to make sure that I have those products available to me when I do have to go out. If I have to go to the doctor's office, if I have to do something, if someone in my house gets sick, I need to have those products so I can handle the disinfection. Because we've got no identified, no evidence, no identified pathway where people are getting sick through packaging at all or food. My best advice for risk reduction is washing my hands after I'm handling any of those packages. And practicing what we would suggest people do in all times, not just around COVID-19, but around food safety. Things like, as I'm preparing food, I'm washing my hands just with soap. As I'm preparing food, I'm making sure that I'm not cross-contaminating anything that might be on the outside of a package with what I'm going to eat. Just those normal everyday practices. And then cleaning and sanitizing, cleaning and disinfecting my kitchen. Those are two things that I want to be doing. I want to promote that people should be doing in all times, not just as it relates to COVID-19. And if they are doing that, then we're reducing the risk as well in this situation.
So do you have a sanitizer that you prefer?
Oh, it's a big question. So I don't have one sanitizer that I prefer at all. In fact, what I'm looking for right now is to make sure that anything that people are using is on a list that CDC has provided to us about EPA registered compounds for coronavirus. And it's in the nerdy world of food safety and in public health, we refer to this list as List N. So I think we'll put a link up to this list. Right now, there are well over 250 different compounds, different names of products that are registered for coronavirus disinfection. And I would just want to make sure that what I'm using is on that list. And I've spent a lot of time looking through that list over the last 10 days, 2 weeks. And the really good news is that many of our household cleaners that we use, household disinfectants and household sanitizers that we use are on that list. But what I did was at the start of this, I went to that list and looked at the things I do have and made sure that what I'm using is on there and registered and we know is effective against coronaviruses in general.
Okay, wow, it'd be good to see that list. I know certainly bleach is on that list, and a lot of people already have that at home.
It is, yeah. One thing before I guess we leave the disinfectants and cleaner side of things, one of the questions that I've been getting, and I'm sure that you've been getting, Margie, and many others as well, is are there any natural products that we could use for disinfectant? Is there anything like tea tree oil or, we've seen citric acid used as a household chemical-free cleaner. And unfortunately, in this situation, there isn't. What we know about COVID-19 is literally very limited, but we do have some data on other coronaviruses, and we believe that it behaves very similar. And so that's why I'm really relying on that EPA list. And if we don't have data, efficacy data for things that aren't on that list. And that's unfortunately the situation that we're in right now, because I know that many of us want to use chemical-free clean labels. There's lots of different words that people are using, but unfortunately in this case, we just don't have anything available to us that we know has efficacy.
Okay, well, what about produce? Certainly other people handle produce, and should you change the way that you wash the produce?
It's a great question. I think that it comes back to one of the things that we talked about at the start. Right now, and again, this information is always evolving. Anytime we've got an outbreak or a new virus or a new illness, we have to make sure that we know that things will change over time. But right now, we don't have any indication whatsoever that food, produce, doesn't matter what kind of food you could name to me, we have no indication that it is actually a vehicle for transmitting this virus. And I think that's really important to think about, because all of the steps that people might be taking when it comes to that food are really over and beyond any risk reduction that public health authorities would recommend. So CDC, the Centers for Disease Control and Prevention, have listed on their website that they don't have any evidence that food is a vehicle. FDA has also released information that they're in agreement with that statement as well. So that all being said, for me, I'm not treating my produce any differently than I would be if I was worried about food safety and produce before. And so rinsing it with running water, if there is some virus that gets deposited there, that'll remove some of it. Even if a virus still remains, we don't have any evidence to demonstrate that that is a good vehicle for transmission. And so I want to make sure that we're really, really clear on this point, that what we really need to be focused on are the actual roots of contamination and infection that we know. And that is, like I mentioned at the top, being around people who are displaying symptoms, and then touching high touch areas like grocery carts or self-serve tongs and spoons, and then not washing hands or sanitizing those afterwards. So yeah, for me, produce is not something that I'm worried about. I'm not treating it any differently because we really don't have any data or any evidence to suggest that I should.
So I guess that means we shouldn't really worry about products that might be imported from China or Italy or other high outbreak areas.
No, and in fact, as we talk today, I think that the U.S. is on the list of high outbreak areas as well. So no, I'm not. I just want to fall back on those public health messages from our federal agencies who are really at the forefront of this outbreak, really emphasizing that we don't really have any indication that any sort of packaging is a good way to transmit this virus. And so imported, domestic, none of those things really matter when it comes to increasing risk around COVID-19 for us, right today. So yeah, no, it's not something that I'm really focused on, or our public health officials.
Okay, well, I want to ask you a couple of questions about takeout food, but do you have anything else to add about grocery shopping or grocery stores?
I guess the last thing that I'd add is that, when you asked about like disinfecting packages, I really want to reiterate the point of I can reduce my risk the more I wash my hands. So I'm thinking if I'm getting groceries at the grocery store, or if I'm having them delivered to me, when I get those groceries home, I'm not really focused on where those packages touched from a food contact surface area. We don't really have any indication that that's risky, but I am washing my hands after I put my food away in my pantry. I'll go and use soap and water to wash my hands to really break any sort of very, very small chance that the virus might have been put on my hands through that process. But that's how I'm handling it. One thing we haven't talked about, Margie, that I do want to highlight is the importance of high risk and vulnerable groups not going to grocery stores, not going to anywhere that may expose them to people who are symptomatic or asymptomatic for the virus. And really, and I know this is a hard situation for many of us in rural areas, in urban areas, but our vulnerable populations as they're aging, the elderly, really reaching out and counting on neighbors and friends and family to get groceries for you and drop them off without any interaction. That would be my best recommendation, because as I mentioned before, the biggest risk that we have is being around people who can transmit this virus to us person to person.
I'm wondering about the grocery shopping services as well. That might be a good option for someone in that high risk category.
Absolutely. I think that's a phenomenal option. And there's clearly no good time to have a pandemic I think that the infrastructure that we do have around grocery delivery services or even curbside pickup at many grocery stores that wasn't there 10 years ago really does help us in this situation. It's a great risk reduction step. Any way that I can limit being around people, even if it's just 10 people in a grocery store, if I can limit that down to one person who's dropping off my groceries, I'm effectively reducing my risk quite a bit.
Yeah, that's a great option. So what about, let's say someone doesn't have cooking skills. I mean, I have friends that eat out all the time. Obviously, we can no longer go into restaurants, and I really feel for the restaurant workers who have lost their jobs. But we do have takeout that's available, and you know, some of our local folks are really promoting that to keep those restaurants open. So do you have any concerns around takeout or drive-through foods?
I really don't. I mean, and I say that as a way of, if I'm comparing the risk of takeout, of increasing my risk of getting COVID-19, I really have no concern over that. I think takeout, just like delivery services, is a great step. I know I've worked, you know, not to be too cliche, but literally around the clock over the last 10 weeks or 10 days, couple of weeks with restaurants on this exact issue. And really from the business side, how can they reduce their risk of transmitting the virus to people, right down to asking people to order over the phone so there's no exchange of cash, using apps, takeout, drive-through. I really think is a very safe alternative. And especially as you mentioned, I would absolutely advocate not going to dining rooms. And I'm very supportive on many public health jurisdictions, you know, closing that option of being around people because there are so many high touch points. Personally, I've used takeout over the last week, and I'm practicing the exact same very basic steps when I get home. I have a bag, I wash my hands, I'll transfer my takeout to a plate. So I'm not like handling something multiple times, even though we have no evidence that says that packaging really even is a risk factor for transmission. I'll move it to another plate and I'll eat, and then I'll wash my hands, you know, multiple times through this process. So I think takeout is a very viable alternative. And to your point as well, I think it's one way for us to keep our food service industry with some stream of income, and in many cases, individuals, not just those who you know don't often cook, but in many cases, our drive-through, takeout, curbside pickup is a good source of nutrition. You know, nutritional calories for the dollar for many individuals. So it's one of the things that I really don't want people to be afraid of, and want to make sure that we're you know, talking through the very small risk associated with it.
So let's say that you did ingest the coronavirus. Do they know what goes on in your body if that happens?
So it's really kind of a complicated situation right now with that. And the complicated situation is, and I'll talk specifically about the coronavirus that causes COVID-19. We really just, the scientific community really just identified this virus in the last 75 days. So we don't have scientific evidence of, you know, feeding studies or exposure, but we do have really good epidemiology to demonstrate that we don't have this transmission through food, and that's what we're relying on. The other pieces of information that I can share is that the biology of this virus, not to get super nerdy about it, but some viruses are just genetic material that go into our system, infect our cells, take over our cells, and create more genetic material by the millions. This virus actually has a coat on the outside of it that's made of protein. It's called an enveloped virus, and that virus, that envelope that's around in that protein coat, actually is not very stable in the low pH of our stomach. So, and stomach acidity really we believe takes care of this virus. It's not to say that, that there's not a potential in this process. There is always, as a scientist, we don't talk in the absolutes. But what I'm seeing from the data, what I'm seeing from our public health individuals out there, our agencies, is they're looking at what happens in the virus, that there are it's unlikely to make it through our system unless it's coming from respiratory droplets and infect that way, that we're really talking about like a 1 in 10 billion chance that ingesting it could lead to infection. And again, I want to be clear that it doesn't mean that it's not possible. It's just we look at risk, and it is not a risk factor for illness. And that's, we haven't identified it now. We have no evidence to suggest that. So that's, but we're also learning stuff every day. And this message 10 days from now might change, 6 months from now might change, or it may never change, but the science is evolving very quickly.
So somehow everything you've shared today has made me feel a little bit better. I could feel my heart rate rise when I went into the grocery store last time, and so maybe today when I go, I'll won't feel so much anxiety. So I really appreciate you sharing with us today, and I just want to say that it's great to have. There's so much out there, so it's great to have an expert like you to bring us research-based information. Thanks so much, Ben.
Great, thank you, Margie.
And thank everyone else for joining us.